Hey, Dr. Lindsey and Wendy here. This is a little discussion on scars, and I've posted a bunch of threads on various forums that have the words double-edged sword, because guys come in with a scar and then with the scar out, but they also want some hair, and so if you take a wider strip in order to get some hair and all the scars, then it makes your job of getting the scar better even harder. So this character saw us in 2009, and he is a nice enough fella. He was a pro athlete from Europe at that time, and he had a pretty wide scar. So take a look at that. And that's a big scar, right?
Yes, it was a very wide scar.
And then I cut it out and got 1,500 grafts. So here's this strip, and as you can see, it contains his entire scar. And now, prepare yourself. If you've got a weak stomach, turn away now. Here's the back of his head, and that's my finger. It pulls wide open. And again, these are done under local. This guy would tell you it doesn't hurt. But we got to close that thing, and that's a big problem. And so I got it closed and got his stitches out at day 5 when he flew back to Europe. Can't say Ireland. When he flew back to Europe. And then he sent me pictures at 4 months out. And typically, if you're going to have a scar problem, it's going to be in the first month or two. And he looked great. And then I didn't hear from him except for phone calls for 8 years. And I guess just to summarize, he lost a little bit more hair, as I expected him to. And he got back into aggressive training at 4 months. And his scar widened out some. Nothing like what it was. So we went in last week and excised his scar. And I think we got about 1,300 grafts and got him all closed up without any tension. And I expect his scar will be skinny like it was at 4 months. And he's no longer a professional athlete. He is a different occupation that doesn't involve athletics.
He promised he was going to take care of that scar.
Yeah, promises it. But the other thing I wanted to get across to you guys is the suture removal. We have a link on our website on how you take out our stitches. And we do have a fair number of people that fly in from overseas or out of the state. And typically a wife or a friend or your family doctor can take out the stitches. It's pretty straightforward, but unfortunately this guy went to see a 60-year-old internist in the government healthcare system in Europe who FaceTimed me, and I explained to him how to take out the stitches, and it should take roughly 3 minutes with no pain if you get it done at this office. And the guy emailed me after 30 minutes. The doctor sent him home to rest, and he went back later the day. And then our patient sent this text message. It has a little bit of vulgarity in it, so I won't read it, but this is definitely not the way you want to have stitches removed. So if you're planning on traveling for a hair transplant, potentially arrange for your suture removal before you come. Or better yet, stay with us the entire week.
A week.
Yeah. Or get your wife or your girlfriend or your brother just to watch our video. But it should be painless, virtually painless, and take roughly 3 minutes.